When it comes to cannabis and mental health, there are a lot of loud, polarized opinions. Today, we are setting the loud debate aside and looking entirely at the cold, hard medical facts. For decades, the medical world has treated mental health and substance use as completely separate issues. If you have depression, you go to a psychiatric clinic. If you struggle with substance use, you go to a rehab program. But human beings do not live in separate medical compartments. Treating these overlapping conditions in isolation leaves doctors with an incomplete picture, resulting in misdiagnoses and treatment plans that inevitably fail. This document is a study published in early 2026 in the Journal of Psychiatric Research. It provides a definitive look into exactly how these two medical issues interact. This paper is a meta-analysis. You can think of a meta-analysis as a master file. Instead of relying on one isolated experiment that might have flaws, researchers gather dozens of different studies from all over the world and combine them to find the ultimate consensus. The scale of this specific master file is massive. It compiles 55 individual studies, tracking the health data of nearly 3.3 million people globally. The researchers had a clear two-way objective. First, find out exactly how many people with a cannabis use disorder also suffer from depression. Second, reverse the lens and find out how many depressed individuals have a cannabis use disorder. The researchers also disclosed no major conflicts of interest, establishing a completely neutral baseline for the data. Looking at the combined health patterns of 3.3 million people eliminates the statistical noise and random data outliers. The math leaves us with clear, undeniable truths about how these conditions behave across the human population. Let's begin with the first direction of the findings, looking specifically at the prevalence of major depressive disorder among people already diagnosed with a cannabis use disorder. This chart shows the calculated totals from those combined studies. Looking at the overall rate right at the bottom, we see that roughly 31% of people with a cannabis use disorder also have severe depression. To give that number meaning, we have to look at the baseline. The global average for severe depression in the general population is just over 3%. That is a tiny fraction compared to the 31% rate found in the cannabis cohort. Severe depression is occurring at roughly 10 times the normal rate in this specific group. A statistical spike this severe points to a structural reality. Depression and cannabis use disorder are systematically linked. Now, let's reverse the analytical direction. What happens when we check for cannabis use disorder among people already diagnosed with severe depression? The researchers found that roughly 10% of people with major depressive disorder also have a cannabis use disorder. Once again, look at the general population baseline. Only about 0.3% of the public has a cannabis use disorder. Jumping from 0.3 to a full 10% represents another massive statistical leap. But the researchers uncovered a context variable that changes these numbers drastically. Where the patient is located matters. If a depressed patient is inside a dedicated psychiatric clinic seeking treatment, the rate of co-occurring cannabis use disorder jumps from 10% to nearly 30%. Clinical environments act as a magnifying glass. The closer a person is to needing acute psychiatric help, the more deeply intertwined these two conditions become. We have to be precise about what this evidence actually means. This study proves a strong correlation, but it does not claim strict causation. The data does not show that using cannabis creates depression out of thin air. It also does not prove that having depression forces someone into a cannabis addiction. Instead, the reality looks like a cyclical, two-way feedback loop. Often, patients attempt to self-medicate their depression with cannabis. Over time, that long-term use makes it much harder to manage their emotions, making the depression worse, which in turn leads to more substance use. The medical data does not care which condition came first. It simply proves that they actively feed into one another. Stripping away the societal moral judgments around weed reveals a cold, unignorable medical reality. For patients, the mandate is clear. You cannot effectively seek treatment for one of these conditions while actively hiding the other from your doctor. For healthcare providers, the mandate is exactly the same. If a patient presents with either depression or a cannabis use disorder, screening for the other is now a mathematical and clinical necessity. To actually heal patients, clinical silos must be abandoned entirely in favor of treating the whole interconnected picture.